All right, let's dive into what's really one of the most significant decisions many families face: childbirth. I mean, we're seeing this huge global shift. Caesarean sections, they've gone from, what, under 5% to over 20% globally in just 50 years. It's kind of staggering.
Yeah.
So our mission today is basically to help you get the crucial info you need to feel genuinely informed about your choices. Specifically, vaginal delivery versus an elective C-section, assuming an uncomplicated pregnancy. Okay, let's unpack this.
That global shift is truly quite dramatic, isn't it? And what's really fascinating is how much it varies place to place. You look at countries like Brazil, Turkey, Egypt. I mean, over half of all births are cesarean there.
Yeah.
But then you go to parts of sub-Saharan Africa and the rates are still below 5%. That might actually signal, an underuse of a procedure that can save lives.
Right, there's not just one simple story.
Exactly. It shows it's about medical advances, sure, but also shifting preferences, both from patients and providers. The real question is, what does this massive change mean for someone, for you, making that decision right now?
Yeah, and when we look at vaginal delivery, what I find really interesting are those deeper physiological benefits for both the parent and the baby. For the baby, it's like their first big hello to the world, biologically speaking. Can you talk about what actually happens?
Absolutely. Think of it as nature's, initiation process. As the baby travels through the birth canal, that pressure helps clear fluid from their lungs. That's obviously vital for starting to breathe properly. But maybe even more profound is the exposure to beneficial bacteria along the way.
The microbiome seeding.
Precisely. We're really starting to understand how crucial that is for developing the baby's immune system. There are studies linking vaginal birth to, potentially lower rates of things like asthma and allergies later in childhood. It's not just how they arrive, but what they encounter.
That's fascinating. For the mother.
Well, generally, the physical recovery is much quicker, usually maybe 1 to 2 days in the hospital, and feeling more like yourself, back to normal activities in perhaps 1 to 2 weeks. Plus, a really key point for future pregnancies: no uterine scar means a lower risk of certain complications down the road, like placenta issues or the rare but serious uterine rupture.
Okay, but it's not all smooth sailing.
Correct.
There are downsides.
Definitely. Labor can be long, it can be painful, let's be honest. And there are risks like pelvic floor injury or perineal tears, that's the tissue around the vaginal opening, or sometimes needing help with forceps or vacuum and assisted delivery.
Right, so that's a strong case for vaginal birth, especially those long-term points. But then there's the elective C-section, that predictability, that control. I can see how that would be incredibly appealing, especially in our busy lives. What are the main advantages there?
That predictability is a huge factor for many people, yeah. Choosing the date, knowing when it will happen, can really reduce anxiety about the unknown of labor starting. And obviously, you avoid the pain of labor itself, although it's important to say, you do have surgical pain afterwards.
A different kind of pain.
Exactly. And for the mother, long-term, an elective C-section can significantly lower the risk of things like urinary incontinence or pelvic organ prolapse later in life, where internal organs might shift downwards. Plus, you avoid any risk of perineal trauma during birth.
Okay, but it is major surgery. What are the trade-offs?
It absolutely is major abdominal surgery. So it comes with the standard surgical risks: bleeding, infection, potential blood clots, reactions to anesthesia. These are generally low risks, but they exist. And the recovery is definitely longer. We're talking typically 3 to 4 days in hospital, and then maybe 6 to 8 weeks before you feel fully recovered.
That's quite a difference from 1 or 2 weeks.
It is. And for the baby, there tends to be a slightly higher rate of initial respiratory distress, needing a bit more help breathing at first. And some emerging research, again, points towards possibly slightly increased risks of childhood asthma and allergies, similar to what we talked about not getting with vaginal birth.
So putting this all together, what does this mean for you, the person actually facing this decision? We hear about guidelines, right? Like the WHO suggesting optimal C-section rates are maybe 10–15%.
Yeah, those guidelines exist, and they often highlight concerns about rates getting too high without clear medical need. And there's a strong recommendation against elective C-sections before 39 weeks unless medically necessary because of those newborn breathing issues.
But it goes beyond just guidelines, surely. It's personal.
Absolutely. Your individual situation is paramount. Your age, any health conditions you have, what your previous birth experiences were like, if any, and crucially, your plans for future children. That uterine scar matters more if you're planning a larger family.
And what if you've already had a C-section? Is vaginal birth still an option?
Often, yes. That's vaginal birth after cesarean, or VBAC. Success rates are actually quite good, generally between 60 and 80%. There is a small risk, about 0.5 to 0.9% of uterine rupture along the scar line, which is serious, so it needs careful monitoring and discussion.
Okay, so it really sounds like it comes down to weighing everything for your specific circumstances.
Precisely. And research consistently shows something really important. Women who feel genuinely informed, who feel supported in their decision-making process, tend to report much higher satisfaction with their birth experience. And that's regardless of whether they had a vaginal birth or a C-section in the end.
So feeling empowered in the choice is key.
It really is. Which brings up a bigger question, doesn't it? How do we as medical teams, as a society, really empower you to navigate all these details, these risks and benefits, and make a choice that truly feels right for your values and your life?
Yeah, because ultimately, there isn't one single best way to give birth that fits everyone. That seems clear. Both vaginal delivery and electing C-section have their own distinct sets of risks and benefits for both parent and child. The best decision is just so deeply personal. It really requires that open, honest chat with your doctor or midwife, looking hard at your situation, the medical advice, and what feels right for you.
Exactly. And maybe a final thought to leave you with, considering how important feeling informed and supported is. Think about everything we've discussed today. Was it the sort of deep physiological benefits of vaginal birth? Was it the appeal of predictability with a C-section? Or maybe just the power of having this information to make your choice? What part of this deep dive resonates most strongly with you as you think about your own unique upcoming birth experience?